Margaret is 67 years old. She always loved her morning walks, but for the past few months something is wrong. She feels tired by noon, sometimes even by 10 in the morning. Her daughter saw bruises on her arms, small ones at first, then bigger ones. Margaret couldn't remember how she got them. Last week she caught a cold. It won't go away. Her gums bleed when she brushes her teeth. Yesterday, she walked up the stairs and had to sit down for 20 minutes. She couldn't breathe properly. Her daughter told her to see a doctor. The tests came back. The doctor said, blood cancer. Margaret is not alone. Most older adults don't know that blood cancer grows quietly. The signs are so small that people think it's just normal aging. Understanding blood cancer is not just one disease. It's a group of cancers. They affect your blood, bone marrow, and lymph system. Anyone can get it. But the risk goes up after age 50. Doctors say most blood cancer cases happen in people over 65. Why does this happen? Because as we get older, our bone marrow gets weaker. Bone marrow is the soft tissue inside your bones. It makes blood cells. When we age, it doesn't work as well. Cells make mistakes. Our body can't always find and destroy bad cells. This creates a place where blood cancer can start. Here's the problem. Blood cancer doesn't always show clear signs. It looks like tiredness, small infections, body aches, things we ignore every day. That's why knowing the facts is so important. Types. Blood cancer starts when bad blood cells grow out of control. These cells stop healthy blood cells from working. Your body needs red cells to carry oxygen, white cells to fight sickness, and platelets to stop bleeding. There are three main types of blood cancer. You need to know the difference. First, leukemia. Leukemia affects your blood and bone marrow. Your body makes too many bad white blood cells. These cells can't fight infection. They push out the healthy cells. Your body becomes weak. Leukemia can be acute, it grows fast, or chronic, it grows slowly. Chronic leukemia is more common in older adults. Because it grows slowly, people don't notice it for months or years. Doctors also warn that some types of leukemia can hurt your heart. Second, lymphoma starts in your lymph system. That's the network in your body that fights infections. It attacks lymphocytes. These are a type of white blood cell. There are two main kinds, Hodgkin lymphoma and non-Hodgkin lymphoma. Early signs include swelling in your neck, armpits, or groin. But it doesn't hurt. Many people ignore it. They think it's just a small infection. Third, myeloma. Myeloma is also called multiple myeloma. It affects plasma cells in your bone marrow. Plasma cells make antibodies. These help you fight sickness. When myeloma starts, bad plasma cells fill up your bone marrow. This weakens your bones. It hurts your immune system. Older adults with myeloma often have bone pain, usually in the back or ribs. They get sick often. They feel tired. Bones break easily. Kidney problems are also common. The bad proteins made by myeloma cells can damage your kidneys. Causes. Here's what many people don't understand. Blood cancer doesn't come from one thing. It comes from changes in your genes that build up over time. Every time a cell divides, there's a small chance of a mistake. Most mistakes are harmless, but sometimes a mistake affects genes that control how cells grow. As we age, these mistakes add up. Our immune system gets weaker. It can't always destroy bad cells. Things we've been exposed to over our lifetime also matter. Radiation, certain chemicals, some viruses. Family history matters too. If a close relative had leukemia, lymphoma, or myeloma, your risk is higher. But most people with blood cancer have no family history at all. Signs. Blood cancers hide very well. The symptoms look like other common problems. That's why people miss them. Here's what to watch for. Always feeling tired, even after rest. Getting sick often or taking longer to heal. Bruises or bleeding you can't explain, like nosebleeds or bleeding gums. Swollen lumps in your neck, underarms, or groin that don't go away. Losing weight without trying. 10 pounds or more. Night sweats, so bad they soak your clothes. Bone pain, especially in your back, ribs, or hips. Feeling breathless during normal activities. Pale skin, or feeling weak all the time. One of these symptoms alone doesn't mean cancer, but if you have several of them and they last more than a few weeks, talk to a doctor. Risks. What happens if blood cancer is not found early? It depends on the type, but the truth is serious. With leukemia, the bad cells can cause severe anemia. You feel extremely tired and dizzy. Your immune system gets very weak. Getting sick becomes dangerous. Your blood can't clot properly. This increases the risk of bleeding inside your body. Lymphoma can spread to other organs, your liver, your lungs, even your brain. Myeloma can break your bones. It can cause kidney failure. It can make calcium levels in your blood too high. This affects your heart and brain. Doctors say that finding cancer early doesn't always mean a cure, but it greatly improves your outcome. Many blood cancers can be managed for years with treatment. People can still have good quality of life. Ignoring symptoms lets the disease get worse. Treatment becomes harder. Side effects become stronger. Prevention. Let's be honest, there's no sure way to prevent blood cancer, but there are things you can do to lower your risk and stay alert. Know your health history. If you've had cancer treatment before, autoimmune problems, or family history of blood disorders, tell your doctor. Don't ignore ongoing symptoms. Tiredness and bruising are not always just getting older. If something feels wrong and doesn't get better, get it checked. Keep your immune system healthy. Diet alone can't prevent cancer, but eating fruits, vegetables, lean proteins, and whole grains helps your overall health. Don't smoke. Limit alcohol. Both increase cancer risk. Get routine blood tests. A complete blood count, called CBC, is a simple test. It measures your red cells, white cells, and platelets. If these numbers are off, it could be an early sign. It doesn't always mean cancer, but it's worth checking. Remember, awareness doesn't mean living in fear. It means having knowledge so you can act fast if something is wrong. Blood cancer is serious. But today, we have better treatments and more knowledge than ever before. Early awareness and good medical care have changed outcomes. People like Margaret, who noticed her symptoms early and got help, are managing their condition. They're still living full lives, spending time with family, doing things they love, staying independent. The important thing is to listen to your body. If you or someone you love is over 50, take a moment today. Review the warning signs we talked about. Share this video with family or caregivers who need this information. Knowledge saves lives. Sometimes the most powerful thing you can do is pay attention. If this video helped you, please like and subscribe. Stay informed about heart health and medical awareness. Leave a comment below. Have you or a loved one had any of these symptoms? Let's help each other by sharing what we know. Take care of yourself. Your health matters.